After an ACL reconstruction, the graft is not usually the thing that holds somebody back, it's the quad. So how much quadriceps strength you rebuild is one of the strongest predictors of outcomes after an ACL surgery and getting back to your level of sport. And we all know ACL is a devastating type of injury, but it really comes down to how can you get back quickly. And what I wanted to help you understand is that one of the biggest things that impacts this ability is nutrition. So let's go into the data and see where the gap is of people getting back to function after an ACL reconstruction. I'm Dr. Patrick Denard, an orthopedic surgeon with over 15 years of experience and founder of the Thrive Protocol. And one of my passions, aside from surgery, is nutrition. I learned this as an athlete myself, and I've taken this to my patients to help them get back their recovery and take control of their recovery to really improve their outcome. Now, what carries across every orthopedic surgery, regardless of what type it is that if you have a mobilization, you cut into a joint and the muscles around it, you start to get atrophy. And this occurs within days. This is the same whether it's a knee or a shoulder or a hip. And this is where nutrition can actually make a massive difference. So there's probably three groups of people watching this. You have the competitive athlete who may be in season or have a scholarship on the line. You have the recreational athlete who really finds their sport on the weekends and the nights a way to really offload, and it's a part of their makeup of their life. And then you have the parent who's watching their kid put all this work into their sport and get injured on the field, and they just desperately want to get back to their sport because it has so much meaning in their life. Now, for all of those situations, nutrition plays a huge role in your recovery, and that's shown across multiple fields within orthopedic surgery. So all three of them are looking at 9 to 12 months, and all three of them have a short list of things they can do to really control their recovery. They pick the surgeon, they comply with their rehab, and then there's nutrition. So here's what happens with quadriceps after ACL surgery, and it's faster than most people expect. Once you undergo surgery, you have, as we described before, cutting into the joint and cutting into muscle. You get muscle atrophy, and that doesn't happen over months. It actually happens within days. And you get weaker from disuse. There's also a mobilization associated with this. The knee joint sends a signal to shut down the quad. It's called arthrogenic muscle inhibition. Your brain stops fully recruiting the muscle, so you get atrophy as a recruitment problem. Now, the combination is why quad strength lags behind everything else. Your graft is healing on schedule, everything's happening inside, your range of motion starts to come back, but the atrophy or the strength is lagging behind, and that also leads to proprioception changes in the ability to perform on the field, whether you're a competitive athlete or whether you're the recreational athlete. So the number that really matters more than anything else is quad strength symmetry. It's one of the best predictors of return to being on the field. And this is why therapists will emphasize it so much, building the quadriceps back up, because the quad is not a detail of your recovery, it is your recovery. So what does the evidence actually show? This is where it's really important to talk about leucine. Leucine is a branched chain amino acid. It's an essential amino acid. This means you cannot form it in your body. You have to get it from your diet. And leucine is the most important amino acid in muscle synthesis. This is why it's really important in ACL specifically. So for instance, studies have shown that if you take people and bed rest them, healthy individuals, mid-age, and you give them a regular diet, they get substantial atrophy after doing that. If you, however, give them leucine, 3 grams, they will actually have less muscle atrophy and even potentially offset muscle atrophy. So what you're trying to do is overcome the body's desire to develop atrophy by supplying the appropriate amino acids or signals to help offset atrophy in this setting. Now, if you look at the data specifically on ACL, there are not as many studies in particular. There are really good studies in total knee arthroplasty that look at this, that show that strength is better when you have amino acid supplementation. You have a study, for instance, that looked at a series of ACL patients specifically. They found that athletes who supplemented with leucine lost less quadriceps strength. It was about 3% versus 16%. Now, that difference doesn't sound like a lot, but when you're talking about a high level of performance, a 3% to 16% can be all the difference in getting back in the field. And it can be the difference also not only of getting back overall, but it can be a timeline difference of getting back. Another piece of evidence that I think is worth taking note of, in addition to the leucine and immobilized people that I spoke about earlier in this study in ACL specifically, is there was yet another study specifically in ACL reconstruction, and they looked at a combination of protein and vitamin C formulation. And those who supplemented actually had less narcotic use, better functional scores, and better graft maturation on MRI. Now, that's really interesting because what vitamin C does is it plays a role in collagen production, hence potentially the graft maturation aspect. Another thing that I think is really interesting is the vitamin C data is paralleled in other fields such as wrist and spine, as well as trauma, which have shown that if you use vitamin C, you have less pain afterwards. Now, that's important for two reasons. One is recovery and getting to do your rehab. Two is that narcotic usage aspect. And that's one of the worst things that I can possibly see in a young individual who gets on narcotics afterwards and unfortunately gets addicted to narcotics, and it becomes a long downward spiral. And we've seen that in young people, but we've also seen that in famous athletes after surgery in general, and we all know who I'm talking about. So I think what makes ACL different, and it's similar to a few other procedures in orthopedics as well, is the length of recovery. So you don't lose the game in the first couple of weeks, you really lose it over months. Yes, it's important to intervene in the first couple of weeks in nutrition, as I've outlined, but you also see people fall off. And what's really important is that nutrition is maintained over a period of months after surgery, because that's really where you're going to supply your body with all the fuel to recover. Because remember, healing doesn't just occur immediately, right? Healing goes through a process where you have inflammation and then you have remodeling that occurs over months and months. I think it's also worth stopping here and talking about what if you're a parent watching your athlete on the field. Of course, there's all the emotional tie that goes into this and seeing the athlete get back. But another thing that happens is that, unfortunately, teens specifically prone to have poor diets. They want to go for the quick thing. They want to go for the carbohydrate granola bar right out of the gate. That gives them a quick satiation, but unfortunately, then their body drops off right away. And what they really need is high protein on a consistent basis. So that involves having healthy meals, but another way to do that is with supplementing in between with protein. And that's what I really encourage my young athletes to do. Now, I see this in my own kids. I provide them great food, but they want to go pick the simple thing, the quick hit that's going to make them feel better. But when they're going through that recovery phase in particular, it's really important that they have all the protein on board to recover. And interestingly, data has looked at young athletes in particular who undergo surgery, and it's surprising that they have a lot of micronutrient deficiencies. What even shocks me more is this same study that looked at this in people under the age of 18 found that despite these risk factors, many athletes don't want to take nutritional advice. So you have to make it simple for them, and you have to make it where protein is a non-negotiable in the recovery phase. And so I think it's important for them to understand that their body needs these nutrients to heal. And if you get them to buy in, you can improve their chance of getting back to where they want to be. So here's how I would structure recovery after ACL surgery. First, you have preparing in advance. Second, you have surgery. And third, you have your recovery phase or rehab. So how do you prepare in advance? Well, I would consider looking at vitamin D levels. There's data, for instance, that shows that people who have ACL injuries are more likely to be vitamin D deficient, and that the vitamin D levels can correspond or correlate with outcomes afterwards. I personally get vitamin D levels in my patients who are undergoing rotator cuff repair, because shoulder is the primary specialty I do. It's the same concept here. You want to load with protein in advance, at least a week prior. A couple of weeks prior is even more ideal. Then you have your surgery. How do you prepare for your surgery? Well, surgery is a stressful event. You need to have the nutrients on board to recover. How do you do that? You carbohydrate load just like a marathon runner does. You want to do that with a complex carbohydrate. That's why we created OptiCharge. It doesn't raise your blood sugar levels, but it provides the carbohydrate loading that your body needs for that immediate energy. Because anytime you go into an event, whether it's an athletic event or the stress of surgery, the first thing your body's going to do is recruit the glycogen stores. So you want to have those stores there so that your body doesn't go after the muscle as energy source, which is going to be depleting your recovery. And then finally, you want to go into the recovery and rehab phase. So you want to have a good rehab, but you need the fuel in your body here again. And this is where it comes back to having 3 grams of leucine per serving. If you look closely, the amount of leucine that you will get in an off-the-shelf protein powder is going to be less than that. It's typically going to be around 1 gram or 2. The clinical data shows that 3 grams is the dose that you need. And that's why we put 3 grams of leucine in OptiFuel. If you're not going to go with that approach, you want to get a good high-grade protein, and you probably need to consider supplementing with leucine in addition. So whether you're a competitive athlete trying to get back, or a recreational athlete, or a parent, hopefully you understand after watching this video that nutrition is one of the simplest things in your control to improve your outcome. Your surgeon does your operation once. You're going to do rehab 3 times a week at least for several months. And if you're really going to take that seriously, you're going to add nutrition to make sure you have the fuel in your body to recover quickly. For full research, the articles I mentioned, check out our ACL page on what to eat after nutrition and how to improve your outcome after ACL surgery. The link's below. If you want to thrive, we have the code THRIVE10 as well. And remember, surgery is one day, recovery is months around it, so prepare for both.